being a black man with HIV in Washington, D.C. has not been easy. My story starts here at Whitman Walker. July the 13th, 1990, I was diagnosed with HIV. And I remember my doctor telling me, you might live to see 50. You will not live to see 60. And friends that I really loved and cared about, a lot of them, most of them, have died. And I planned my funeral twice. I picked out my grave. So I have seen the good, the bad, the ugly, the desperation of HIV. I knew that I could be relatively comfortable coming here. I would not have the stigma attached to me being a same-gender loving man.
Whitman Walker moved from a VD clinic in the basement of a church basement, responded to the HIV crisis, and really were able to be there when people's families and loved ones and others shunned them and turned them away. And the responsibility today of honoring all of those individuals who are no longer with us is the most important thing of what we do.
I started coming to Whitman Walker about 2 years ago because I wanted to go somewhere where I felt comfortable at for a young youth LGBT individual. I've been HIV positive now for 6 years and undetectable for 6 years as well.
Hi.
Hey, how you doing?
Amazing medical advancements have been made in the delivery of care for patients who are HIV positive. 25 years ago, we had fewer medications available, and so that's really one of the importance of having research in the federal government and the academic institutions really supporting the development of new medicines, is because now we have one pill once a day regimens that people can take that have very little toxicities or side effects, and they're able to be healthy and happy and live absolutely normal everyday lives that everybody gets to live.
So I take one pill, it's called Genvoya. I take it every night before I go to bed, and it's like a vitamin pill to me.
I participated in taking the first drug for HIV, which was AZT. They had not worked it out to a fine science, and a lot of people were getting ill because they couldn't tolerate it. I was one of those people. And today it is so much better.
And your date of birth.
Younger folk can do one daily dosing. I mean, that's a miracle, you know. And now with the advent of PrEP, we are really moving toward a time when the eradication of HIV, I believe, is going to be a reality for folk.
It's not that bad of a illness anymore, and you can live with it. And if we all can come together, as far as being negative and or positive, we can bring the stigma down and more people could get tested, and we can really destroy this whole epidemic of it.
I think especially for World AIDS Day, and what World AIDS Day means, December 1st, 2017, I think the most important thing is that people just need to know that HIV is still something that is around and still needs attention and still needs resources and still needs support. We can change the narrative and we can change the way we talk about it. We can talk about it being something you take a pill every day for, that getting undetectable means that you're not able to transmit the virus, and the changes we've made at prevention and engagement and what that looks like to be positive and to be negative, and what love and relationship and sex and intimacy looks like in 2017. But we need to talk about it. That's the importance of December 1st, is having that conversation and to have it openly and honestly, and the more you talk, the more you reduce stigma.